Good evening and a warm welcome to all our followers on social media. Thank you for joining us on this Sunday evening as we get ready to gain some extremely important knowledge. Thanks to May 5th being commemorated as World Pulmonary Hypertension Day, this entire week is being dedicated to spreading knowledge and increasing awareness about this frequently misdiagnosed disease, and that's pulmonary hypertension. To understand more about pulmonary hypertension and its management, we have with us today a panel of experts. On behalf of MSN Laboratories and Times of India, I would like to welcome Dr. Manish Juneja, MD, Medicine, DM Cardiology, FACC USA, FESC Europe, Interventional Cardiologist at Rhythm Heart and Critical Care, Nagpur. Dr. Manish, welcome.
Thank you.
Dr. Pankaj Raut, MD, Medicine, DM Cardiology, FACC USA, FESC Europe, Intervention Cardiologist at Rhythm Heart and Critical Care, Nagpur.
Thank you, ma'am.
Dr. Aziz Khan, MD, DM, FACC Senior Cardiologist at Crescent Hospital, Nagpur.
Hello.
Dr. Shubhrato Mandal, MD, DM, DC, FIEIC, FICC, FCPCI from Italy, FACC USA, FSCAI USA, Consultant Cardiologist at Ubuntu Heart Hospital, Bhopal. Dr. Natik Parvez, MBBS, MD, MD, DNB, Respiratory Medicine, and Consultant Intensivist and Chest Physician at Kunal Hospital, Nagpur.
Hello, everybody. Thank you.
And Dr. Rishi Lohia, MBBS, MD, Medicine, DM Cardiology, FACC USA, FSCAI, Intervention Cardiologist at Kingsway Hospital, Nagpur. Good afternoon. Doctors, welcome to all of you. And thank you for sparing your time to be with us today. Without any further ado, I'd like to post my first question to Dr. Manish Juneja. Dr. Manish, could you help us understand what exactly is pulmonary hypertension?
Good afternoon, everyone. So, today we are talking about pulmonary hypertension. A very common thing which we all understand is hypertension. Hypertension is people understand is systemic hypertension, and pulmonary hypertension is very different from it. Systemic hypertension is the pressure of blood which flows through your body. It's the pressure pumps through the blood to your whole body. As far as pulmonary hypertension is concerned, it is the pressure at which the heart pumps the blood into the lungs. So practically, it is the pressure of the arteries.
I think we do have a slight internet connectivity issue. Dr. Manish, I think perhaps because you're traveling, we're not able to hear you very clearly.
Repeat it. Am I audible now?
Yes.
No, there is a lag. There is a considerable lag in the communication. All right, I'll tell you what, Dr. Manish, I'll make you comfortable. Let's just take a little bit of time. Perhaps when you reach another juncture, the net might get better. So let's move on, and I'll pass on the question because we do need to talk about this in a little more detail. Dr. Pankaj, I'm going to hand over the question to you. Let's start with what is pulmonary hypertension, and could you please explain that to our viewers and listeners?
Yeah, common public understand hypertension, that is blood pressure in the systemic arteries. So similarly, there is a pulmonary artery, the artery which supply blood to the lungs. So if pressure is increased in that artery, that blood vessel, we call it as the pulmonary hypertension. And it is due to many things related to lungs or heart or anything which affect the vasculature. So pulmonary artery hypertension is usually a difficult thing to treat, and it affects young females and younger people more. So important disease because it's affect our working or important class, important population.
Thank you, doctor. I think I'm going to stick with you and just ask you one more question, which is, how common is pulmonary hypertension?
Yeah, it's not that common compared to systemic hypertension. Systemic hypertension is very common, but still pulmonary hypertension is a big disease because our population is aging and there are problem of cardiology. There are problem of like restrictive heart disease and diastolic dysfunction due to hypertension. They lead to pulmonary hypertension. So incidence of pulmonary hypertension is also increasing in our population.
Thank you, doctor. Dr. Aziz, let me take the next step in this conversation to ask you, is pulmonary hypertension hereditary?
See, there are many causes of pulmonary hypertension. And out of which, if you look at, we can find out many causes by investigating. But
Yeah.
there are few cases where we can't. Yeah.
We will get to the causes, but I thought we could deal with it.
I'm going ahead.
Yeah.
But there are some cases where we don't find any cause. And that we call idiopathic pulmonary hypertension. Out of which there are some cases where there is family history of pulmonary hypertension. So we got familiar pulmonary hypertension. If you look at incidence, about 20% of patients will have idiopathic or familiar pulmonary hypertension. They don't differ from routine pulmonary hypertension patients. But you need to look at the family history. If there is family history of pulmonary hypertension, if some people, some relative have died early, you have to find out. But many times you will not get such history and you need to find out. And therefore, sometimes you will need to do genetic counseling and genetic testing. And but they exactly are similar to that. But yes, I agree that it is a 20% of cases out of all are familiar or hereditary.
So what about age and genetics then? Does age play a part and do genetics play a part?
They manifest early as compared to other causes. Yeah.
Oh, you mean that pulmonary hypertension comes earlier?
Early in their cases.
Okay. And like Dr. Pankaj had said, perhaps affects women more than men.
Yeah.
Okay. So who exactly is at risk, doctor, for this?
Again, familiar or general?
Understood. Okay. Thank you, doctor. Dr. Subrato, now let's move to the causes. Can you tell us what are the factors that can cause or contribute to pulmonary hypertension?
Regarding the factors which contributing for the pulmonary hypertension, we have to understand 2-3 different parts, just like getting clots or anything which is because that, as you already told by a previous speaker, that the main reason is pulmonary arterial some thrombus, or it goes supplies to the right side to the pulmonary lungs. Totally, you can say lungs. So from there, whatever it goes through the lungs, through the veins to the lungs, that can cause either DVT. Because of the DVT, the clots maybe go inside the lungs. That also got hypertension, pulmonary hypertension. Second thing, maybe some air emboli. Sometimes it can be with the placenta, whether maybe the amniotic fluid emboli, and there will be some fat emboli when there's very big fractures in them. These are the parts which is because of emboli. Second thing is sometimes if because of infections, sometimes many patients they used to drug abuse, like they used to do a lot of injections for the cocaine or something. So that also can cause a lot of emboli, infective emboli. And second thing is the heart failure related. One is lung emboli related, second is heart related. Heart related means there's congestive heart failure, you can say, and right heart failure, and many others, just like very defect in the hearts, like ASDs, VSDs, PDAs, and any other cyanotic heart disease. These are the defects which is can causes the pulmonary hypertension. And secondly, one more thing important is that HIV. There is also important causative factor. And another important is sleep apnea. Sleep apnea is very common nowadays because of obesity. That obesity causes sleep disturbances, and later in future it starts developing our pulmonary hypertension. And moreover, a lot of other cancers, just like liver disease and kidney disease and others, which is increase the coagulability, means the thickness of the chances of what you call the coagulation factors in our body increases. That makes very small thrombi, or we can call clots. that other important factor which eventually lands into the pulmonary arterial hypertension. So these are the basic causes that clots or embolia related. Second is heart related. Third is the lung related. Lung related means emphysema, chronic bronchitis, many chronic disease, COPD, and other lung disease whichever can all any disease which theoretically leads to pulmonary hypertension. So these are the closely factor. Another important factor we can say there's a connective disorders, just like rheumatoid arthritis, scleroderma. These are the factors, lupus. These are also important factors that can cause pulmonary arterial hypertension.
Thank you, Doctor. Dr. Natik, let's move to the next part of this entire journey of, enlightenment. What are the symptoms of pulmonary hypertension that patients must be looking out for? Dr. Natik, you're on mute, please.
Yeah. So, patient may have increased shortness of breath, chest pain, palpitation, easy fatigability. Then patient may have pedal edema, swelling in the feet. And as we know, PH, pulmonary hypertension, is a hemodynamic and pathophysiologically a multi-condition. Patient may have a multiple the condition-related symptom like left heart failure condition, or symptom related to sleep disorder breathing, or OSA is very common, and connective tissue disease related. So the symptoms may be related to the multiple condition which cause pulmonary hypertension.
Thank you, Doctor. So you're saying that these are the things that should give our patients a clue that perhaps there is something that is not
wrong with them.
okay.
Yeah.
Correct. Yeah. Thank you, Doctor. Dr. Rishi, my next question is to you. We are talking about pulmonary hypertension and, detecting it through these kind of symptoms. But what if it's left untreated? Will it cause complications? And what are the complications that patients should be aware of?
Right. So see, as for any other disease, if this disease is not treated, definitely it progresses and it can lead to a lot of complications. Now, the challenge with pulmonary hypertension is many times the symptoms are non-specific. So as the previous speaker was talking, so there is no particular symptom that will point it towards the diagnosis of pulmonary hypertension. It is the clinician who can pick up these symptoms and reach to the diagnosis. However, as we'll understand or as we discussed, that this disease is a neglected entity and many times it goes undetected. Now, when the pulmonary hypertension is it persists for a long period of time, it leads to multiple complications. Now, heart has got two parts, one on the left side and other on the right side. Now, pulmonary hypertension is the increased pressure on the right side of the heart. It is the circulation which connects to right part of the heart. And now this part is designed in such a way that it is not meant to handle high pressures. But when in pulmonary hypertension, it is exposed to high pressure, this part of the heart starts dilating and eventually it decreases its pumping power, leading to failure, what we call it as right heart failure. Now, right heart failure typically presents with swelling in the legs. Patients will have fluid collection in the stomach or abdominal distension, what we call it as ascites. They'll have fluid collection in the pleuras, that is the cavities around the lungs, causing pleural effusion. And eventually, as and when this disease progresses, there's decrease in the blood pressures, there is excessive fluids in the body, breathlessness leading to death. So right heart failure is the most dreaded complication of pulmonary hypertension if it is untreated. And once patient progresses to this stage, most of the times it is not treatable. And only way out is probably heart lung transplant, which is not accessible to most of the patients.
Thank you, Doctor. Dr. Manish, my next question is to you. As we go along, especially in today's day and age, with lifestyles being what it is, are you finding that there seems to be a lowering of the age group that are being affected by this? Or is there a significant, any kind of an incidence among any particular age group thanks to today's lifestyle?
The age group which pulmonary hypertension affects is relatively younger as compared to systemic hypertension. But it depends which cause you are dealing it. As the earlier speakers have pointed out, the various reasons of pulmonary hypertension, various causes of hypertension, pulmonary hypertension. It depends on the age group which the cause uh, which we are dealing with. So if it is an autoimmune disease, if you're dealing with, that's the group 5 according to WHO. So it will usually affect the middle-aged females who are normally affected by these diseases like scleroderma, like other autoimmune diseases like SLE and all. And if you are dealing with a primary pulmonary hypertension, that's even at a younger age group, you can have people between 15 to 45 years of age presenting with symptoms of pulmonary hypertension. So this is according to WHO Group 1 of pulmonary hypertension. And the second important cause of pulmonary hypertension is heart disease itself, like the left ventricular failure, heart failure. So these patients are more older when the heart failure leads to secondary pulmonary hypertension. Patients of COPD, bronchial asthma can be between bronchial asthma are younger and COPD are higher in the higher age group. So all in all, you have the age group depends on the cause which we are dealing with. But yes, young age, middle-aged females are the most common people we see with pulmonary hypertension.
Thank you, Dr. Manish. And I must say, your connection is absolutely fine and you were crystal clear. Thank you so much for that. Dr. Pankaj, now can you tell us and help us understand how exactly is PH diagnosed? So what are the type of tests that you would recommend to diagnose the disease?
So the pulmonary artery is deep inside the chest cavity. So it's difficult to diagnose pulmonary hypertension, and usually patients come very late. So the symptoms are after symptom there are certain tests like echocardiography which can easily non-invasively diagnose pulmonary hypertension. Then there are other tests which are invasive like cardiac catheterization, CT scan, HRCT of chest, contrast CT of chest. And there are multiple blood tests which we are required to do to understand what is the etiology of that pulmonary hypertension, because there are many diseases. PH is a complication of many diseases like connective tissue disease, hypertension, and heart failure, obesity. PH is a complication of pulmonary hypertension, is complication of certain disease. So we have to find out what was the initial injury. So we may require many blood tests for connective tissue disorder, and patients should undergo and should be willing to do them, because that can find out whether it is curable or not.
Thank you, Doctor. Let's just move on now and talk about, so now that we have also considered and dwelt on the diagnosis. Now, Dr. Aziz, it's time for us to discuss what are the treatment options for pulmonary hypertension.
As you have been told that it is a deadly disease, it needs to be treated as early as possible. Now there are two factors. One is supportive therapy, specific therapy for pulmonary hypertension, and treatment of the cause. So as soon as we diagnose pulmonary hypertension, usually they have low oxygen saturations. So they need oxygen therapy. They need vasodilator, which dilates the pulmonary arteries. So you need drugs like vasodilators, and then they are congested. So they need diuretics. These are the drugs for the supportive care. There are some specific drugs which have been approved for pulmonary hypertension in the different group of drugs. Some are IV, some are inhaler, and some are tablets. So there are a lot of drugs like bosentan, ambrisentan, get now recently approved. These are the drugs. We have to give these drugs as per the need, and then watch. And then what Dr. Pankaj said, what are the causes? So you want to find out the cause, whether it is because of heart disease or deep vein thrombosis. If it is deep vein thrombosis, they need anticoagulants. If it is because of heart disease, you decrease the pressure of the heart. So like a specific therapy to give. But now I have been practicing last 35 years. There was no therapy for pulmonary hypertension in past, but now there are very good drugs available, and I'm telling you, it has changed the outlook of the patient. Like bosentan and mesisentan, and now get all these drugs are very effective drugs, and it has changed the lifestyle.
So basically, what we should be able to communicate to patients is that there is
Yeah, this
treatment of.
therapy. Yeah.
Mm.
Don't get disheartened. If you have been diagnosed pulmonary hypertension, there is a now solution for that.
So, like you already mentioned, but I'm just going to ask you to reiterate it further. Since we've discussed that there are different kinds of pulmonary hypertension as well, is the treatment similar for all or is
No.
it specific?
No. There are 5 groups of pulmonary hypertension. So, as per the diagnosis, you have to treat.
Correct.
If you diagnose pulmonary thrombus, then you have to do anticoagulants. If it becomes structural heart disease, if this becomes lung problem, treat the lung cause. Obstructive sleep apnea, the Narki said, give CPAP, like that. You have to treat the cause. But there are some drugs which are particular for pulmonary hypertension. So you need to give those drugs in a patient who has idiopathic pulmonary hypertension.
So even when it comes, I'm staying with you and asking you one more
Yeah.
clarification. See, like you said, some pulmonary hypertension starts from lung issues, some from heart issues. So where do patients have to go to get consultation? Which are the doctors they need to meet in order to get the right and precise diagnosis?
I think physician is the best people. Let him go to physician. The patient should go to physician first, then he can sort out. And if there is some pulmonary cause, then he can go to chest physicians. If he has some cardiac problem, he can go to cardiologist. Like that. Physicians are the best people. Even the family physician, they are now aware of, because through this media we are propagating
10 minutes.
that
10
pulmonary
minutes.
hypertension needs to be aggressively treated and early diagnosed.
Absolutely. So thanks to these kind of
This will
awareness
help-
programs.
this will help the physicians also and people to understand the disease
Correct.
problem.
Thank you, Dr. Aziz. And indeed, awareness programs such as these, where all of you come and share your knowledge about it, will definitely go a long way in helping patients understand that they need to meet their physician and then they need to take the consultation forward with the relevant specialist. Dr. Shubhrato, we just finished a discussion saying that young women are probably affected the most by pulmonary hypertension. And when we talk about that particular age group, we're also talking about that means pregnancy as one of the parts of life for young women. So, how does pulmonary hypertension, what should I say, impact pregnancy or women considering pregnancy?
So, for this, my takeoff is like that. If the patient is established cases of pulmonary arterial hypertension, that means his arteries are thickened, and the thickness of the pulmonary arteries are more, and the pressure, especially, not with the reasons that can be treatable causes. Then definitely they should restrict for the pregnancy first of all. But still, I would say that if the reasons, causes of the hypertension is pulmonary arterial hypertension is suppose heart disease or some defects in the heart. So with it operation surgeries, it can be possible that in later after surgery is over or the main causative factors is done, the treatment is done, then in that conditions we can allow the human for the get the pregnancy done. So the main factor is that we have to see the main factors causing the pulmonary arterial hypertension. So if she is already established, not established, or very high pressure in the pulmonary arterial thickness, and including the physiological and pressure is very high, in that condition we can go for pregnancy. Otherwise, first we should treat the cause and then we should allow. As a whole, we should restrict for the pregnancy.
Restrict for pregnancy. So basically, if it's a mild form of pulmonary hypertension, they can go forward with supervision by doctors. But I'm just throwing something out there, and you can help me with this. If a patient is suffering from pulmonary hypertension, they will be taking medication, and they will have to continue it through their pregnancy. Will that be a problem?
Yeah, that is also another important factors, because suppose if you're taking some anticoagulants for this, any DVT is there and you're taking anticoagulants, there is another risk factor for the continuation of the pregnancy. In the later life, there may be some lot of complications get started. And moreover, what is happening is that most of the treatment which is given for the pulmonary arterial hypertension, that also causes pulmonary pressure to be higher side. Suppose if you're giving some anti-hyper failure therapy, there is also another causes giving that later. Heart failure causes again high pressure. Because there's also called sometimes more, just like heparin also sometimes hit that heparin induced homocysteine. That is also another important factor. So many things has to be considered. And if the patient is the corrective causes for the hypertension, I think we should correct the causes for the first, and later we should go for pregnancy. And in milder cases, the consideration to be done, a decision to be taken after the specific doctors, as Dr. Aziz told, that if it's pulmonary causes, then they should treat with by pulmonologist. If the cardiac problem, they should treat with the cardiologist. If she is having some connective disease, that has to be treated first, and then go for this pregnancy.
But perhaps it's also difficult because pregnancy is not really her decision, and it's also a requirement in the social environment that we all are in. So, can you tell me, therefore, what is the impact on families that we are looking at?
So definitely, I would say that first of all, we should look for the patient first, and second, the family second. Because once I'll get the patient goes complications after, suppose you're taking some risk and all the things, and then later like, there is a risk of two lives, not only a single life. That will take risk of two lives, and that should be always to be decision to be taken very cautiously, and after consideration with the consultation and consideration with the all doctors treating your hypertension, pulmonary arterial hypertension. So I think restriction is the first options, and second thing, after correcting the main causes for the hypertension, that has to be correction. After correction, you can take a decision, and before that, I think always to be kept in mind that this is a deadly disease, and there is no till date there is no particular specific treatment is available at present. All of the treatment which is available at present are supportive mainly, and no specific treatment is available till date.
And therefore, this must be an educated decision as opposed to an emotional decision.
Yes.
Yes, doctor. Thank you. Dr. Natik, I'm coming.
Can I because this is such an important thing, I would just like to add one thing, although sir has elaborated it. Uh, if it is a primary pulmonary hypertension, I think pregnancy is absolutely contraindicated. I think everyone would agree to it. And what Dr. Subrata was talking about, the secondary pulmonary hypertension, where if the cause is corrected, then they can go for pregnancy. But as far as primary pulmonary hypertension is concerned, pregnancy is absolutely contraindicated. And second important thing is the contraceptive which has to be used, which has to be suggested to the patient, is the barrier method only, or no oral drugs or any other form of drugs can be given to these patients as contraceptives. And thirdly, the drugs which we use in treatment, as Dr. Aziz has told, Dr. Aziz Khan sir has told about Selexipag, about Riasugat, about Bosentan, Ambrisentan. All these drugs cannot be given in pregnancy. So it's a really bad decision to have a pregnancy in primary pulmonary hypertension.
That's good.
Thank you. Yeah. Thank you, Dr. Manish. Yes, sir. Thank you, Dr. Subroto and Dr. Manish, for that, because I think it's very, very important here, because it's not a woman alone. She's not functioning as an individual when she comes to you with a problem. So therefore, very important for us to pay a little bit of extra attention to this particular subject. Dr. Natik, like I was just directing my next question to you. Once a patient has been diagnosed with pulmonary hypertension and is on a path of treatment, what other lifestyle changes would you recommend?
As you know, pulmonary hypertension is a very dreadful disease. Early diagnosis or early suspicion and treatment to prevent the progression of disease is very important. And lifestyle modification got both the preventive as well as therapeutic role in that. And in that in lifestyle modification, we can go with a diet. Diet is very important. Good, healthy, balanced diet is absolutely required in both in before as well and even after diagnosing pulmonary hypertension. So diet include small frequent meal, less carbohydrates, low sugar, and low salt diet is very important. As already said, it causes right heart failure and can cause water retention. So low salt diet is very important. and we have to avoid junk food, heavy meals, and a proper balanced diet is absolutely necessary, including high fiber diet, vegetables, fruits. Then the weight reduction, or to have an optimum weight, is very important. As you know, obesity is one of the risk factor for getting pulmonary hypertension and different sleep breathing disorders. So weight reduction is absolutely important. That to be done with a low, we had to go for a low aerobic exercises. We should not do very heavy exertion and heavy exercises. So they have to go optimum weight reduction, come on to a ideal body weight, and proper exercise is very important for this. And in patient having COPD or lung disorders or other, there's a term called pulmonary rehabilitation. So this got a very important role. This will improve the stamina, muscle strength, and improve the quality of life for this patient. And so pulmonary rehabilitation is very much recommended this in patient diagnosed with pulmonary hypertension. Uh, then stress is one of the very important factor which is often missed. So decreasing the stress is very important. Stress is also causes inflammation, releasing inflammatory mediators, and that can cause some add-on to the disease. So reducing the stress, good proper sleep of 6 to 8 hours, good night sleep, basically I would say, to get a good proper sleep for 6 to 8 hours at least in the night time. Then after you diagnose with pulmonary hypertension, we should avoid traveling to high altitude places where there is oxygen, decreased oxygen level. Um, Weight reduction also help in decreasing the sleep bleeding disorders. And these are all factors which we can do lifestyle modification to decrease the progression of the pH, and to avoid the complications also. So, good ideal weight, good diet, good sleep, this is all important in both preventive as well as therapeutic aspects.
Thank you, Doctor. Dr. Rishi, my next question is to you. Of course, we believe that we have overcome Corona and COVID, and although it's still here and there and everywhere, uh, would you say, in your experience over the last few years, that COVID has added to the increase of chances of pulmonary hypertension among your patients?
Yeah. So see, when we talk about COVID and its association with pulmonary hypertension, there were two things. One thing is we knew that COVID is affecting lungs, and any disease or disorder which affects lung leads to increase in the pulmonary pressures. So technically, it leads to pulmonary hypertension. But fortunately, the lung affection or the damage to lungs in majority of the cases in COVID was reversible, and we can see that even those patients who had very bad affection and damage to the lung, they have recovered quite well over a period of time. So the pulmonary hypertension associated from that perspective, it was most of them reversible. And when patients improved out of it, the pulmonary hypertension improved. As against some patients got the complication in the form of thrombosis. By thrombosis, I mean increased tendency of blood to form clots. So some patients had blood clotting issues. So those clots were maybe in the blood vessels of the leg. Some of them had this clots dislodging from the veins in the leg and moving to the lung vasculature, occluding them. And that kind of pulmonary hypertension is the one wherein some patients had persistent pulmonary hypertension in spite of the therapy or treatment. So definitely COVID has increased the, I would say, prevalence of pulmonary hypertension. But what we were, I mean, fortunately, the lung damage was reversible. So the increase in pulmonary hypertension is not to the scale of the affection of the COVID, but it has definitely increased as compared to what it was in non-COVID.
Thank you, Doctor. Dr. Manish, now that we have, been let out of our rooms post-COVID and our self-imposed exiles are now over, I think everyone is out on the road with a vengeance, and everyone is back to traveling on work or leisure or whatever. And that is no exception even for patients. I think everybody wants to go out there and get a whiff of the free air once more. So, can you advise pulmonary hypertension patients as to how best they should prepare for and go on journeys?
So you have to apply a lot of filters to travel for these patients. So first thing, high altitude travel is absolutely prohibited uh, for severe pulmonary hypertension. Patients with milder disease can still go for travel, but with all adequate arrangements. Like they have to carry a pulse oximeter. Along with that, you should carry an oxygen concentrator along with it, and you have to carry all your medications and take them regularly. Secondly, when these patients travel, they should avoid a severe form of exertion, like if you can't go and trek and climb mountains. So you have to, as they can just do simple walking. So when you go travel, there is a lot of exertion which takes place when you travel, and there is a kind of dehydration in the body which has to be avoided. Patients with say, pulmonary hypertension, when they have dehydration, they can lead to fainting attacks. So they have to avoid these fainting attacks. They have to avoid dehydration. Take a lot of liquids when they travel. Secondly, apart from this, they they should avoid extremes of temperatures. Too hot, not too hot, neither too cold. So you have to select a place which has moderate temperatures and maintain adequate hydration. Take your drugs along with it. Carry a oxygen concentrator or be close to a medical facility wherever you're traveling. Please don't travel to extreme places where there are no medical facilities available. Uh, and people, all these things have to be considered in cases of severe pulmonary hypertension, but people with milder disease can travel with some exceptions. Uh, Apart from that, you should not be traveling alone. There should be some nowadays there is a high trend of solo travel, so you should be traveling with your family member or close friend. So all these precautions have to be kept in mind when these patients travel.
So, like you mentioned, extreme climate, also altitudes will be an issue, no?
Yeah.
So, traveling to what about aircraft flights? Is that a problem?
Yeah, we have to uh, we have to go a medical thorough check. These patients have to go a medical checkup before they take up flight travel. It is not absolutely contraindicated, but as far as possible, it should be avoided in patients with severe pulmonary hypertension. And before you travel, you visit your doctor and take all the medications and optimize everything, and then they should take air travel. And
So
that too shouldn't be very long, like where you're traveling for 20 hours, shouldn't be done.
So basically, I think the point that we would like to reach out there to everybody listening to us is don't take it for granted. Don't assume that you are well enough just because you seem to be okay. That you definitely need to see your doctor before you get on to embark
Yes.
on any journey.
Yeah.
Great. Thank you, Doctor. Dr. Pankaj, let's now just, switch gears a little bit. We already, touched upon the subject, but perhaps you could, elaborate it for us a little more, which is that what are the new treatment modalities and technological advancements that you can tell us about, which will, perhaps improve the quality of life or also better the treatment options for patients?
Yeah, in recent days, the treatment of pulmonary hypertension has improved. A few years back, there was no treatment for pulmonary hypertension. There were only symptomatic thing which used to like sildenafil and tadalafil. These drugs used to dilate the pulmonary artery. They were not actually modifying the disease. But now there are many new pharmacotherapies has come like brosentan, ambrisentan, and like a newer drug Roshigot. These drugs are actually targeting the molecular targets of the pulmonary hypertension, and also they are improving the functional capacity of the patient. Then there are inhaled prostaglandin inhibitor, like which can be inhaled where a patient is breathless, and that causes pulmonary artery dilatation. These are newer modalities and newer drugs which are available that should be taken with help of their pulmonary hypertension physician or a cardiologist.
Thank you, doctor. So anything else that you would like to add? That I think even the oxygen, that some
Yeah.
whatever, that's also new, no? That's not very old in the market.
No. Oxygen is available actually.
No,
They can
there was
carry
some
a-
machine that you said, Dr. Manish, oxygen compressor. No? What was it? Something. No, you're on mute, Dr. Manish.
Oxygen concentrator.
It's an oxygen concentrator.
concentrator.
Yeah.
They should
About,
carry it the home.
How about heart lung transplantations?
Yeah, in India now the facilities have improved for heart lung transplantation. Still, it is out of reach of the patient, but definitely there are many newer center are coming in heart lung transplantation, and it's good treatment, but still require a lot of care even after operation.
But it is definitely a new option that is slowly being
Yeah.
touted as a
Yeah.
viable treatment modality.
Yeah.
Thank you.
I just
Dr.
want to
Bali?
add something. Yeah. The patient who are suffering from this pulmonary hypertension, so they need oxygen is one of the part of the treatment, oxygen therapy.
Yes.
They need to take 16 to 18 hours of oxygen a day. That will help to prevent the progression of pulmonary hypertension. Nowadays, what happened? The patients who are suffering from pulmonary hypertension, they can carry the oxygen. This battery operated oxygen concentrators are there. They are lighter and they can use it for 4 hours or 6 hours. They can use it during air travel, as well as they can go roaming here and there. Suppose they want to go to some visit some festival or travel, so they can use in a small backpack and they can travel with that. So their life quality of life can be at least can improve the quality of life by providing them this portable oxygen concentrators, which are battery operated. They can be easily carried and they can travel with that.
All right, that's amazing as well, because I was wondering whether it would get cleared through security check because it's oxygen. So
Like people
No,
not allowed.
there are some, yeah, they are allowed, and there's some pro forma in the
Medical
flight.
certificate.
Yeah, and we have to provide that certificate. There are some the requirement is there. By every flight has a different requirement for this this oxygen concentrator. There are different standard they have, and we have to purchase that standard oxygen concentrator.
Dr.
Portable
Aziz, you were saying?
Yeah, there I was saying, because we had a lot of problems sending patients sometime with oxygen. They don't allow, they become nowadays with all security problems. But of course, Dr. Naik, if you properly document the things, they will allow.
Correct. Perfect. Yeah. So that is definitely an advancement that people should be aware of, because, this kind of information is also empowerment for people who want to carry on with their daily lives and live full lives, as it is, as we may say. Dr. Aziz, I'm coming back to you. You, in fact, used the word yourself, and I'm coming back to you with a question, which is, what are the supportive therapies for pulmonary hypertension?
See, pulmonary hypertension is a comprehensive therapy. Just the most foremost thing is that patient, doctor, and counselor, they should understand that this is a long-term disease. It requires a lot of therapy, counseling, and a rehabilitation program. So they should understand that it is not enough just you take 1 or 2 tablets in your office. So what lifestyle modification is one of the most important thing. Weight reduction, they should remain active, stop smoking, they should take fresh air, they should not take hot bath, and then not carry heavy weight. At the same time, if they are required, they should have oxygen cylinder at home, or oxygen concentrate. They should take diuretics like that, and then they should consult doctor regularly and maintain their well-being, because it is not a simple drug therapy. It is a long-term comprehensive therapy which may require lifelong.
Thank
So
you,
it
Dr.
is
Aziz.
a group of everybody's,
Yeah.
maybe counselor, physiotherapist, chest physicians, and all things should be involved.
Thank you, Dr. Aziz. Dr. Shubroto, the word long-term brings me to another question, which is pulmonary hypertension curable? I know that it's a difficult thing. We've already discussed this in terms of it being long-term, but is there any hope out there for pulmonary hypertension patients?
So be precise, if I say, then it's not curable, but it's treatable. We can treat it with proper management, many things to be considered, including all the physical, mental, social, all aspects we can think, and gradually all parameters to be considered, and accordingly we can treat the patient. But as far as curable, let's tell that there's no specific therapies available to cure this disease, because this disease is anatomically what happens in primary pulmonary hypertension, and in longer cases, secondary cases, the arteries of the pulmonary artery, I mean, that's the arteries of pulmonary circulations, that becomes thickened. And once it's thickened and the lumen becomes narrowed, once the lumen is narrowed down, that time there's no other options to get it back to the normal size of the pulmonary artery. So there's a major issue with the anatomy of the pulmonary circulation, and that cannot be reverted. So only thing we can do is that we can do some of the treatment that allows the blood vessels of the pulmonary arteries to relax, and to some dilatation of the arteries, and some of the factors that can regulate regularly, just like doing this. I mean, in severe cases, just like suppose patient is admitted, or some of the IV needed. Some of the injections is also available. Some some IV oxygens and that injections and oxygen therapy, diuretic therapy, these are can be given and can be treated accordingly or properly, but not curable is totally. I say precisely that curable treatment is not available to date.
Thank you, Doctor. Dr. Natik, my next question is, can you help us understand the connection between pulmonary hypertension and sleep apnea?
Yeah. So like pulmonary hypertension, obstructive sleep apnea we say, is also underdiagnosed and unnoticed. Generally हमारी society में जो मोटा ताजा है या obese है, they think that they are good, खाते पीते घर का है, and they sometimes use they snore also very loudly. But nobody thinks this how dangerous this snoring can be. So obstructive sleep apnea is a complete or a partial or complete obstruction of upper airway. So during the sleep, our muscle tone goes down and there's a narrowing of the passage. But in this patient, because of like hypothyroidism, obesity, they have more, there's complete or partial obstruction of this upper airway passage. And this will lead to decreased oxygen level in sleep, and can be very dangerous. So what are there are symptoms that we should know what is obstructive sleep apnea. So patient will have a loud snoring. Their daytime and nighttime symptoms. So nighttime they have loud snoring. They even have a choking spell in the sleep, and even they have frequent urination. In the daytime they don't they after sleeping for so long also they will have a fatigueness, not able to concentrate. They have daytime sleepiness, and memory issues, and that different issues. And sleep apnea can affect like I can say from the hairs to the toes. It affects the whole body, because during the sleep our oxygen level falls so much down. And so suppose we generally sleep for 1/3 of our life. 8 hours of sleep means almost 1/3 of our whole life. And if our oxygen level goes so down in for approximately 8 hours, so this will be very detritus for our body. There are a lot of toxins, stress, inflammatory mediators they release, and they cause a lot of side effects. Like there are cardiovascular side effects. Patient with this kind of patient who are having long-term obstructive sleep apnea, they can have an MI, heart attack, they can have congestive cardiac failure, arrhythmias problems, and even stroke also. Patient may have this paralysis attack, stroke, neuropsychotic changes. So this is a obstructive sleep apnea is an independent risk factor for all these complications. This patient develop hypertension, this patient develop diabetes, and they will have a resistant hypertension, require multiple drugs or multiple drugs for control.
I think we've lost, yes, I think we've lost Dr. Nadir.
Yeah. Just a second, I just got a call. So in PH, in pulmonary hypertension, patient who is having obstructive sleep apnea who develop pulmonary hypertension, they have a poor prognostic sign, and this will increase the mortality as well as the decrease the quality of life. So in obstructive sleep apnea patient, first the diagnosis, and in this kind of patient, we should always diagnose pulmonary hypertension, and because if we diagnose obstructive sleep apnea early, we can able to treat it. Obstructive sleep apnea can be treated. First, one thing we can control the if suppose the patient have hypothyroidism or obesity, we can decrease. We can ask them to decrease the weight and decrease the obesity, and that will help to improve the sleep apnea. As well as they can go for a auto CPAP machine. There is a continuous positive airway pressure machine is there. So this kind of patient, they can use this machine while sleeping, and this will help to decrease the snoring and prevent the collapse of the upper airway. So oxygen level will not go down, and the side effect of the complication of sleep apnea will not happen. But we have observed patient who's having long-term obstructive sleep apnea, they will have a more PH. The PH, pulmonary hypertension, will be more progressive in this kind of patient. And if we treat it early, there is a possibility we can prevent the progression of pulmonary hypertension in this kind of patient, and can prevent the complication of both obstructive sleep apnea and as well as pulmonary hypertension. And so it's very important to treat it. And obstructive sleep apnea, there are a lot of patients, they will have a left heart diastolic dysfunction. Commonly, they have left heart either preserve or decrease ejection fraction. So it's very important to diagnose obstructive sleep apnea early, go to a cardiologist, do a 2D echo test to see the pH as well as see the heart condition. So this all are required to prevent further progression of pulmonary hypertension. So treating obstructive sleep apnea in a proper way is very much important, and I think pulmonologists will help them to treat them, as well as is a basically pulmonary hypertension is a multi-modality treatment is required. Cardiologist, pulmonologist, physiotherapist, even in case of connective tissue disorder, autoimmune disorder, rheumatologist. So it's a multidisciplinary approach is required.
Thank you, Doctor. Dr. Rishi, let's move on to one of my last questions, which is, since we are talking about something that affects the lungs also, primarily lungs, can you tell us what is the role of vaccines in the management of pulmonary hypertension?
So when you talk about vaccines and pulmonary hypertension, we can talk in two things. One thing is vaccination to prevent the occurrence of pulmonary hypertension. And second part is vaccination to the patients who are already diagnosed with pulmonary hypertension. So let's assume if patients, normally we see that in our national immunization program, we are giving kids BCG vaccine. So when you're preventing tuberculosis, probably you're preventing a lung disease. And naturally, if we prevent a lung disease, the prevalence of pulmonary hypertension will go down. So this is one part. Second part is, let's assume we have a patient who is diagnosed with pulmonary hypertension due to some or the other cause. Now, if this patient, God forbid, gets a infection in the form of either pneumonia, in the form of viral infection like COVID or influenza, the ability of this patients to tolerate such infections is poor, and many times they succumb to any infection which otherwise will be a mild disease for other individuals. So naturally, we do have an adult vaccination program that is there, but again, unfortunately, it is not very commonly practiced. So on this, because through this media, I like to make people aware that whenever they have any significant comorbidity, like if they have diabetes, if they have blood pressure, kidney disease, if they have a weak heart, that is heart failure, if they have any pulmonary hypertension or any other major disease, if they are survivor of cancer, so these patients do deserve vaccination as religiously as we give it to our kids, so that there are certain infections like viral pneumonias, the pneumococcal infection, these are prevented, and every infection that we prevent probably will prove a life-saving thing. So whenever we have a patient with diagnosed with pulmonary hypertension, he deserves regular vaccination. We have an adult vaccination program in place, and definitely whomsoever is treating that patient will always guide them for this vaccination fit that they are vaccinated and maintain their immunity up to the mark.
Thank you, Dr. Rishi. Dr. Manish, I'm going to end this webinar with a question to you. And this is actually not regarding the patients, but it's regarding the families and bystanders. I think one of the most difficult tasks is when there is a patient in the family with a long-term ailment. How do bystanders cope? How does family cope? So is there anything you'd like to say to the families of patients of pulmonary hypertension?
You mean to say if the if I have comprehended well your question, do you want to know what the family member should be doing, or
Just any word
you
of consolation, any word of advice, any word of hope, any word of
okay.
support to bystanders and families of pulmonary hypertension patients.
So as Dr. Subrato is very well he is very well summed up in one thing. It's the disease is uh, treatable but not curable. And Dr. Aziz has also told us that this is a treatable disease. Patients can lead a normal life with all the drugs which are available, and there is really a good ray of hope for these patients as our research goes on, and we have newer drugs. Every year we have a new drug for pulmonary hypertension nowadays, and 5 years back there was only few drugs which were available. So whatever life these patients have, it can be we can make it we can improve the quality of life by giving them these drugs, and with regular health checkups and all the preventive advice which has been given in this webinar today. These patients can lead a normal life, and this is really a great hope for this patient. And this is a really great initiative from MSN and Times of India for public awareness, which will go a long way in uh, educating these patients about pulmonary hypertension.
Thank you, Dr. Manish. And with that, we will wind up this webinar. On behalf of Times of India and MSN Laboratories, I would like to thank our amazing panel of doctors who've been present here today to help us understand what pulmonary hypertension is all about. Dr. Manish Juneja, Dr. Pankaj Rao, Dr. Aziz Khan, Dr. Subrato Mandal, Dr. Natik Parvez, and Dr. Rishi Lohia. Thank you so much for sparing your time to be with us on a Sunday afternoon. And to all our followers out there, stay healthy, stay happy, and stay hopeful that tomorrow will always be a healthier place for all of us. Thank you and have a good evening.
Thank you.
Thank you.
Thank you.